Good evening and welcome. I am Meeta Roy. And November is Lung Cancer Awareness Month. A time to raise awareness about the leading causes of cancer deaths around the world. Lung cancer causes about 1.8 million deaths each year, more than breast, colon, and prostate cancer combined. It is the second most common cancer with 2.2 million new cases diagnosed every year. Unfortunately, early detection is still a challenge as only 5% of people who should get checked actually do. This segment is brought to you by Shastha Sahay in association with the Lung Cancer Study Group, Kolkata. Today, we'll be talking to an expert about the importance of awareness and early detection. Let's get started.
In diagnosis, the first step is a chest X-ray. Usually there is a lesion in the chest X-ray. Sometimes it may happen that chest X-ray is normal, so a very high index of suspicion in part of clinician is important. Next is a CT scan of chest. And then according to the situation of the lesion in the lung, if it is a central lesion, we'll go for a bronchoscopy. When in a fiber optic scope has passed through now a nose or mouth, and we enter into the lung cavity, and then we take biopsies, because biopsy is what that gives us tissue diagnosis, which is most important in diagnosis. If it is a peripheral lesion abutting the chest wall, we can go for a CT guided FNAC or biopsy, wherein a needle is put via the chest wall into the lesion, and we take the tissue sample, and we diagnose lung cancer. In case of distant metastasis, if there is a palpable lymph node, as I mentioned earlier, in the axilla or in the cervical region, we go for a FNAC or biopsy from that lesion. Sometimes there is lymph node in the mediastinum. Mediastinum means the area within the thoracic cavity within two lungs, and there are some lymph nodes may be present, and if it is present, it can be visualized in CT scan, and if it is present, we obtain sample mainly for staging by EBUS. EBUS is endobronchial ultrasound. We put again specialized camera containing ultra thin scope via the nose or mouth into the lungs, mainly via mouth into the lungs, and then we obtain sample from it. This is the modes of diagnosis. Now CT scan has got another role, albeit not in India, because India currently does not have any screening guideline per se, but in USA it is in vogue, the lung cancer screening program. What they do in US is patients between 50 to 80 years of age, those who have a history of 20 pack years of smoking history, be it current smoker or be it a former smoker, they do a yearly LDCT or low dose CT scan of lung for early diagnosis. And it has been seen in their study that in 20% of cases, they can detect this cancer early. So this is called lung cancer screening program.